Introducing to you today Ginny Eggleston, who is a clinical psychologist who has worked for the Christchurch Hospital Respiratory Service, which includes the CF team, for 5 years. Ginny initially trained and worked as a registered nurse and nursing tutor for 20 years before retraining in clinical psychology. Since qualifying as a clinical psychologist, Ginny has worked predominantly in healthcare settings. She has also worked in research, studying different psychotherapeutic treatments for depression. Ginny is currently completing a research project exploring the influence of psychological factors on treatment adherence in people with cystic fibrosis in the Christchurch area. Sue Lovelock has been in the position as our Southern field worker for the CF Association of New Zealand since 2007. Sue has a large client load, working with individuals and families living with cystic fibrosis from Wellington to the Bluff, a large area. So a little clap to sort of welcome them here today and watch their session.
So, hi, nice to see you all here today. I'm Ginny, and this is Sue. We're going to be doing a bit of a tag team, so we'll be jumping up and down a bit just so that you don't get bored with one or other of us. We had a fairly broad topic when we were asked to speak, so hopefully there'll be something in here that you find of interest. I'm just going to figure out how to work the equipment. So our topic was an independent life, finding and achieving balance in adulthood. Actually, it would be good to have a show of hands. How many people are from Australia? Oh, fantastic. Welcome. Okay, so what we're hoping to talk about today is, first of all, give you a bit of an update on what research says in this kind of area, talk a little bit about independence and interdependence, balance, what that might mean, and the kinds of things that might influence or things worth considering that might affect how easy it is to achieve that balance. Particularly looking at some of the psychological things such as mood and anxiety, and I'm going to briefly mention some of the findings we've just found in our Christchurch study, look at coping, the role of significant others, recognising your own situation, what those challenges might be and resources, and I'm going to touch a little bit on goal setting. It's something that we all hear a lot about, but just kind of a refresher, I guess, losses and grieving, and then hopefully at the end some time for discussion and questions. So just before we begin, I want to be really clear, Sue and I definitely don't feel like we're the experts. In fact, we feel like we're talking to the experts. And so it'll be really important and interesting to get your feedback and any kind of guidance or suggestions or comments. But what we hope is that you will take something away from today. But also while you're listening to us talk, it's very hard to talk to a big group and kind of get a sense of individual people. So everyone's going to be at a different stage. Different things are going to be influencing you and how you're managing with achieving balance at the moment. So what does most recent kind of research tell us? That people with CF, their lifespan's increasing significantly, and in 2010, more than half of all people with cystic fibrosis were expected to be over the age of 18. The median survival age range has increased dramatically, up from 14 years to 37 years in 2008. And the proportion of adults with cystic fibrosis has quadrupled over that same time period, from 88% to 33%. And the median survival from after 40 was expected to be 13 years in a 2010 study. So that tells us there's been lots of advances in CF and CF care, and that people are healthier and living longer into adulthood. But there's also some other research that's saying adults with CF have not realised their professional and psychosocial achievements comparable to the improvements with health. And I guess we're going to just kind of have a little look about why that might be. But the kinds of things that they've... Oh, it hasn't gone on. The kinds of things they're talking about that compared between 1999 and 2008, people's overall health has improved, but not some of those adult milestones that you might expect people to achieve. In fact, employment status has decreased from 51% to 45% of those people working in full-time work. And there was an increase in disability and unemployment benefits from 23% up to 29%. No change in education, so people weren't staying on and completing their education more as you might have expected. So it's kind of stayed the same at about the 40% mark. And no change in marital status, so people weren't getting married more often. So why might that be? I'm going to hand over to Sue.
If you had a child born about 20 years ago with a diagnosis of cystic fibrosis, you're probably told that they wouldn't live to be much past 15 or 20, so you wouldn't have given your child terribly much pressure to go to school or achieve overly because they weren't going to need an education terribly much or a big job, or and you just wanted to treasure them and enjoy them and give them as nice a pleasanter, happier life as you could all have. So there wasn't the expectation that they would become productive adults like they need to today. And the need to maintain healthcare is, CF is a burdensome condition. It takes a long time every day to manage with your physio and your enzymes, and you're eating all the time and you have to exercise 3 to 4 hours a day. And a lot of people thought, they weren't worried about education and they weren't going to have a partner or kids, so they didn't have to think about things like that. And there's no big relationship between lung function and efficacy scores or coping scales in life. So. One of the adults in Christchurch, the week before he died, he said this. He was 35. If I'd known I was going to live this long, I would have taken better care of myself. And he said, and maybe had a relationship. So these days they are living longer, and our people need to take better care of themselves and have an expectation that they will be working and productive members of society, and need to have life skills to cope with problems that come along the way that before parents might have sheltered them from and taken care of. And so this is a bit like burning the candle at both ends, having quality of life as well as more years. So independence. Independence is about, of course, being your own boss, not being controlled by others, showing self-confidence. So there's some definitions of independence. And then we come to interdependence. And this is what we all, at some stage of our life, need to go between dependence and interdependence. So independence and interdependence is when you're not so well and you need to just rely on somebody for a little while to help you along with things. You're still the same person, but you're just borrowing some strength and support from some other people for a while. And if you've got CF when you're sick, it's maybe going home to mum's for a meal, or letting someone tidy up your house, or do some percussion physio on you, or just come around and keep you company. Connecting to others with minimal strain and tension. And so we use it more when we're unwell. And you go between independence and interdependence. It's not a condition you're in, a state you're in all the time. It just goes, when you're not well, you may need to ask for help. And I know people struggle with that a lot. But everyone I've spoken to who has helped people, they're more than happy to help. So it's the ability to share, grow, assist and love other people. What other greater joy is there? So research shows that chronic illness can encourage dependency on family and medical and staff if not handled well. And our adults need to be well informed and understand their illness and treatments. And it will move from the doctor to the patient. Yeah, it goes from the parent to the patient as the person gets older and achieves adulthood. And we want to get them towards autonomy and independence, because with increased life expectancy, there's every reason to expect now that our adults will experience the highs and lows of life, just like everybody else now. So you have to be prepared. We have to prepare and equip our young people with problem-solving life skills and emotional maturity. And Ginny will talk about balance.
So where does that leave us? How do we get that balance between independence and interdependence? It's not black and white. It's not independence or dependence. It's something that's fluctuating and flexible, and there are always new challenges, and it depends at what stage you're at, both in terms of how old you are, but also what else is going on with your life and your health in particular. So it's a complex thing, and the aim is to maintain healthy and active and fulfilling lives. And basically it's every individual's responsibility, but how do we achieve our, maximise our responsibility, achieve our goals? It's recognising when your needs are changing, what your strengths are, what your supports are, and the resources that you have to draw upon. And it's also important to recognise as an individual what things influence your ability to maintain that balance. What things can you work on, what things can you improve, but also what things can you not change and that you need to work on, just accepting it as it is, this is how it is. So the kinds of things that we're talking about, things that you might want to consider. Developmental stage, we often hear a lot about that in terms of people at a different transition stage, and that's often talked about in terms of health, transitioning from the paediatric service to the adult service, but also there's a lot of life transitions from primary school to intermediate school to high school to leaving home to your first flatting experience. So there are lots of little challenges on the way, and that all takes part in terms of playing this role in terms of how do you balance these things. Depression and anxiety, I'm going to talk a little bit more about that in particular because we know that people who are struggling in terms of their mood or are more anxious, it impacts on all sorts of areas of their lives and ability to manage. Stress is a less obvious thing, but it's part of everyday life and it's very individual to you as an individual. It's unique. What things are stresses for you may not be stressful for the person next door to you. So recognising some of those things for yourself can be really important. Obviously health is a key player. What your coping style is like. What kind of methods you use and how effective they are. Role of significant others. Sue's mentioned that a little bit, but we're going to talk about that a little bit more. And obviously life events. How confident you are, what your self-efficacy is or your self-esteem or how good you are at you are at managing these things that life throws at you. So I'm going to look at most of these a little bit more closely now. So psychological factors, what does the research tell us to start with? So that people living with chronic illness have a greater risk of depression. And so with people with cystic fibrosis, different studies measure different things, but the range is between 29 to 40%, so that's pretty high. And so why would we worry about that? Well, what the studies also tell us that untreated depression may lead to serious consequences, problems with adherence, missing clinic, risky behaviour, and worsening quality of life. Anxiety too is a significant factor, and it's a key player in adherence to treatment. What we know is when people worry about something, they tend to avoid it. And so if you're worrying about cystic fibrosis or a change in your health, you may be less likely to want to think about it, less likely to do the things that maybe are important in keeping yourself as well as you can. There's been a TIDE study that Alexandra Quittner from the United States has rolled out all over the world, but in relation to the study that she's done, she found rates of anxiety and depression 2 to 3 times higher than the general population. So this is just a little quick look at the Christchurch study that we did, and just draw your attention to the red numbers. So for anxiety, we found rates of about 20%, so that's the 12 and the 8 added together of people who are endorsing possible anxiety or significant anxiety symptoms. And that's compared with 36% that Alexandra Quittner found over in the United States. So for anxiety, maybe we're doing a little better. For depression, our rates were 12%, so 8 possible and 4% significant symptoms of depression. In comparison with Alexandra's, pretty much similar. So what I thought it might be important to do or interesting to do is to talk about depression a little bit more and how might you know if you're depressed. A lot of people talk about depression and they say I'm depressed, but actually sometimes they're not, but it's really important to recognise if you are. It's a diagnosable disorder, and sometimes we excuse away some of our physical symptoms as just being part of our health, but actually it may be that something else is going on. So recognising depression is important. So I'm going to run through what some of those symptoms are. So the first one obviously is about your mood. You feel different to how you would ordinarily feel, and that can be low, sad, flat, or grumpy, and particularly for young people, depression often can present as being more irritable, more grumpy than usual. If you're just grumpy for a day or a morning, you're not depressed. That's just normal. But it's about thinking about what's normal for you, and are you quite different to how you normally are and for a period of time. So the next thing is changes in your interest or your pleasure. So the things that you're normally interested in and enjoy doing, you can't be bothered anymore. You don't get the same kind of thrill out of it. You don't enjoy it the same. And obviously it's going to change if you're not feeling so well. So physically you're not feeling like getting out riding your bike. But if you're also not feeling like hanging with friends, something that you can do whether you're feeling well or not, then those are another kind of a symptom to watch out for, a warning bell. Changes in weight. And this is one that often people might put down to their health and explain it away for that. But for people with depression, health changes are a significant marker, and that can be either a weight gain or a weight loss. So it doesn't have to be just a loss, it can also be a weight gain, and changes in your appetite. And markedly different for you, how you would ordinarily expect to be. Sleep, and like weight, the sleep can be a lot more or a lot less. So some people who are depressed find that they find it really hard to get out of bed, they want to sleep all day, and then they can sleep all night as well. So they're sleeping a lot more than they ordinarily would. And the opposite side of that is not sleeping much at all. Sometimes having problems falling asleep but then doing okay, or waking in the middle of the night and waking a lot, or waking a lot earlier than you would ordinarily. And sleep can sometimes be put down again to your physical health. When you're not feeling so well, your sleep gets disturbed. So in and of itself, it's not necessarily saying you're depressed, but it's something else that sometimes we think may be just due to our health, but it may be that there's an underlying mood problem as well. People with depression sometimes talk about something that's termed psychomotor agitation, but that's when they're kind of jittery, on the move all the time, can't sit still, and it's obvious to other people. Other people comment. It's not just something you might feel a bit in yourself, but other people notice. Or the absolute opposite of that, psychomotor retardation. That means really heavy, leaden limbs, kind of can't be bothered, and just lifting your arms, hard work. It's quite different and unusual feelings that people experience in their bodies. Energy, again, this is another one that we often can excuse away or pass off as maybe it's due to our health, but people who are depressed talk about having no energy. They just don't have the same kind of drive, and just they feel very fatigued all the time, unrelated sometimes to whether they're getting good sleep or not. And here are some of the more thinking kinds of things that sometimes are easier to pick if you're not sure, because you're wondering if it's your health that's making you feel tired. You start to change the way you think about things. You start to feel worthless. You kind of looking to the future. You can't really see anything hopeful happening. You start feeling guilty about things. You worry about things. Your thinking changes. People also notice a change in just their ability to think clearly. They can't concentrate, so they find their minds wandering in a conversation. They can't watch their favourite television program anymore. Or when they're reading a book, they pick it up and they can't remember. So what was this book about? So real changes in the way you can think. Sometimes people say they can't kind of make decisions, and that's not big life-changing decisions, but what shall I wear this today? What am I going to have for breakfast? So down to some really simple things, problems with decision-making. And a really important one is increasing thoughts about death and or dying, and with thoughts about wanting to harm yourself or take your own life, and or having a plan or taking some action on that plan. So that's a really worrying symptom, and it's not normal, and so it's something that's really important to share with someone. So one of these things on its own doesn't mean you're depressed. Two of these things on its own doesn't mean you're depressed. To get a diagnosis of depression, you need to have at least 5 of those symptoms. And obviously some of those are going to be a little bit tricky, because you may wonder if it's about your health. But if you've got 5 of those symptoms and they're lasting for more than 2 weeks and it's very different to how you would ordinarily be, then it's something worth thinking, maybe I need to talk with someone about this. And these are good things to think about yourself, but also to notice about people around you, because other people might say they're depressed, and now you've got a bit of information about what depression might mean. And a key thing that I missed out was you need to have number 1 or number 2, one or other of those. It needs to be one of the 5. You can have more than 5, but a 5's a minimum to get a diagnosis. So I'm going to talk a little bit about anxiety, and that's another important area that we're aware can influence how people cope and manage, but also we know that if we're anxious about something, anxiety in and of itself is an uncomfortable feeling, so we try and avoid doing things or thinking about things that make us feel anxious. And particularly for cystic fibrosis, if you're anxious about your health or worried about your health, studies show that people who are more anxious are less likely to take their treatment. They don't want to think about it. They're pretending it's not a real thing. So it's pretty important to recognise anxiety and whether that's a factor. So what are the key symptoms of anxiety? There's a number of different anxiety disorders, so I'm not going to run through all of those, but I'm just going to talk about some of the key symptoms. But 2 probably most common ones that people more generally might experience is generalised anxiety, so that's kind of worrying more days than not and most of the day, or panic disorder, and so that's when people start getting panic attacks. And we know that people with respiratory problems are more vulnerable to having panic attacks than the people with in the general population. So, key symptoms, obviously anxiety or worry, feeling apprehensive, kind of thinking something bad's about to happen but not quite sure what it is, and aware that you're thinking about it a lot of the time, and those thoughts are hard to control. You're aware of more of a physical kind of feeling a bit restless, on edge, kind of keyed up. And because of the amount of energy that being anxious uses up, you often feel tired because it's using up energy. You have problems concentrating, or your mind goes blank, kind of you lose where you were. What was I thinking about? Again, irritability, so that's, I know that I mentioned that as a mood thing, but it also can present with anxiety. Muscle tension, so when people are anxious, their bodies tighten up, and so they feel tense, and they feel tired because they're feeling tense a lot of the time, and problems with sleep. So I'm going to briefly just talk a little about stress, because that's sometimes less obvious, and it's often not till things have got pretty bad that you notice that you're under a bit of stress. So stress is a normal part of everyday life. It's something that we require when something that happens that we're required to adapt to or react to, but it can become a problem if it's happening a lot of the time. And our fight-flight response, which is a normal evolutionary response that helps us get out of danger, if that's continuing being active, we can start to have problems which can lead to anxiety and tiredness. It's more subtle than anxiety, as I said, so it's sometimes harder to pick.
So we know now that people with CF are living longer than predicted. So sooner or later, their health is going to get worse, and it may be sooner rather than later. And the aim is to have as good a quality of life as you can throughout all the stages of your life. And this takes a bit of planning and responsibility around, so it's about expectations to adherence, medications and physio and all the things you have to do, planning a career that is not going to put you at risk health-wise, or that's something you can do part-time as you get more unwell later and you want better quality of life. Apparently France has a higher than average ratio of people with CF in high-paid jobs, because they do the banking and the financial planning and the jobs that earn lots of money, and you can do part-time, they have office jobs that you can work part-time or go up the management market and get better money for. Thinking about money and family and having a bit of a support plan. So I think someone swallowed a bit of a thesaurus before they wrote this definition. Coping is a process of managing taxing circumstances, expending effort to solve personal and interpersonal problems, and seeking to master, minimise, reduce or tolerate stress or conflict. So coping styles are basically the way we respond to problems in our lives or traumas. It's the way you cope with it physically, thoughts, emotions and behaviours. And it's an important way of balancing life's stressors and adjusting to what's going on. Denial's a good one. Humour. Humour's a good coping style, and apparently women use it more than men, and it works better for the girls. So what coping style works best for you? Depends on what's going on, really. So if it's mainly a controllable problem, there's problem-focused coping, and that's finding out information about what's going on, learning new skills to help deal with it, and changing or eliminating the source of the stress. So this is more for practical-based problems. And so you make a list of steps to take and then you'll follow them. And the emotion-focused coping is looking at our emotions, distracting ourselves or avoiding things, managing your hostile feelings, getting really peed off and angry and uptight, or meditating, using relaxation techniques, taking responsibility, positively reappraising what's going on and changing the way you think about things, having lots of social support, getting enough sleep, food, exercise, fun. And coping styles change over time, the time in the situation, and people often use a combination of both of those styles. And this is just something that I've used myself with problems. CALM, just C-A-L-M, change what you can, accept what you can't, let it go and manage the way you react to it. Now Jenny's going to talk about significant others.
Hope you don't mind us dancing around. We just thought it would be easier to take turns. So I'm going to talk a little bit about significant others, and it's important to talk about the important people in our lives and the part that they may play when things aren't going so well. It's important to think about what message you give to other people and how do they know what it is that you actually need. This person isn't doing so well. So a little bit about what research tells us about partners of people with CF. There's been quite a few studies looking at marital adjustment, anxiety, depression and emotion and social support focused coping. What the research suggests is that actually marital adjustment is pretty good, and it's in fact higher for men who are patients than men who are partners, and the reverse for women. So it was higher for women who were partners than were patients, or the person with CF in this case. Anxiety was high for at least one partner in 10 of the 16 couples. So in 10 of the 16 couples, one person had a problem with anxiety, and the 7 out of 16 had a problem with depression. So anxiety and depression is a significant factor in partners as well. Didn't look a lot at what the impact was for parents, who are also another key part of the support package, but again, rates of depression and anxiety were high and higher for parents than partners in particular. So depression rates 30%, anxiety 40 to 50%, so pretty high. So it's something about being a parent and the extra responsibilities that come with that, but also maybe the challenges about managing that change of stepping back and letting that young person kind of fly the coop just can be more challenging. So talked a little bit about the kinds of things that might be challenges and might impact on your ability to maintain that balance and maintain your independence as best as you can. But there's also help out there. So if you had some concerns about how you were doing or how someone in your family was doing, there's different kinds of therapy that can be used alongside medication, either or medication with medication. And in particular, cognitive behaviour therapy is a useful technique that really looks at how you're thinking about things and how you're responding to things and how that might be impacting on how you manage situations. And there's a new kind of wave of therapy that's looking at mindfulness, so that's more about really looking at what's happening now rather than worrying about what's coming ahead, so kind of drawing your attention back to what's happening now, and that maybe helps you do some of that more problem-focused or emotion-focused coping in the moment. In New Zealand, we have a psychologist attached to the Auckland adult CF team, as we do in Christchurch. I'm not sure what the situation is like in Australia in terms of easy access to support, but I do remember that Australia, and I'm not sure if it's still occurring, that you could get government-funded therapy for a year, so that's still a factor. So it's recognising a need and actually doing something about it. That's what you can do. So where to from here? It's kind of recognising your own set of challenges, things that influence you. How might you achieve your balance? It's a little bit of back to basics. So it's not always about something new or something different, but it's about reflecting on how you're doing at some of those more basic things. What's your sleep like? Is there something about that you can change? Are you a night owl and then have to get up early for work and then feeling tired? What's your diet like? Exercise, we know that actually the more active you can be, the better the health benefits are, but also the better the benefits are for your mental health. Looking at your work-life balance, reviewing, how you're going with that. It's not a fixed thing, it's a fluid thing, and sometimes the job that you were desperate to get and loved is no longer the job that you really love, and it's starting to take a toll. Thinking about those support networks, and a little bit like the message that you give to the people around you. If you talk with someone in a crisis, that's much harder to get the support you need than maybe planning ahead, talking with them about, when I'm like this or when this happens, this is what I'd really appreciate you being able to help me with. So thinking about what you know about yourself, what's going to work for you. Everyone's different. Some people like someone close to them if they're struggling. Some people need a bit of distance, but the people around you don't know that if you don't share that with them. So it's important to do those regular reviews. Look at the patterns in your life, which are the ones that you want to keep on happening and which are the ones you want to look at changing. And a way of managing that or thinking about that is looking at your goals, setting some goals. We talk a lot about goals and goal setting, but sometimes we're not that good at them. So I'm just going to briefly just give you some help around that. What kinds of goals do you set? And what impact might they have on how you're doing? So how helpful are your goals? So another acronym of SMART goals. So that's SMART, the S is for specific. If we just say, I want to be fitter, how do you know if you've achieved your goal? So it's about being really specific about what it is that you want to achieve, having a measure around it so that you actually know that you've got there. Something that's achievable. I want to climb Mount Everest. Well, it's not, for me, that achievable, not that realistic and not that helpful. So it also needs to be relevant and realistic, so something that you really want to do. So it's no point setting a goal about something that you're really not that interested in or want to do, and giving it a time frame so that you actually know this is the date that I'm working towards. So if I was to say I want to knit a jersey by the end of the week, well, there's some problems there. I've given myself a time frame. I've been quite specific. I want to knit a jersey, and I'll know when I've completed it because the jersey will be fixed, but I'm not a good knitter, so the chances of doing it in a week is not high, so I'm going to set myself up to fail. And also, I don't actually enjoy knitting, so why would I set that as one of my goals? That wouldn't help me feel good. So think about what your goal is about, what it means for you, how important it is. So I guess in essence what we're saying, it's not work or life, it's not health or life, it's about balance. And so whatever your pie looks like, sometimes some bits of the pie are going to be a bit bigger than others, but what your goal is to try and get the bits of the pie to be fairly even and to focus on working on each one of these. And maybe your pie will have different things in it, but it's about the things that are important to you to get that balanced life. Sue.
Okay, so life doesn't always go the way we planned it, there's surprises. And sometimes it helps not to dwell too much on what's going to carry on in the future, but just to give a little bit of thought to areas like health, employment, full-time, part-time, when to need to ask WINZ for help, things like that. Money, not getting into unmanageable debt. Social, it's really important to have friends, and friendships take a lot of work to maintain. And often when people are unwell, they tend to isolate themselves, so just to be mindful that we need balance in all those things. And what might I do when? So just start thinking about a little plan, and we can all do that in our lives anyway. What happens when our kids leave home? What happens when I can't work full time? What might happen when I want to be a parent? What might happen when I need to start thinking about transplant? What might happen when I need to start looking after myself a bit better? So it's hard to think about our lives when we're not going to be as well as we are today or as well as we want to be. No man's an island. It's really important to have a support crew and discuss with them your plan or what you want to happen. Think about what you could give away when you start having a bit less energy. Places on committees, doing many things for other people. This may be a time to just stop that and look after yourself better. Using the energy you have effectively. Having easy meals, working less hours, just basic practical things that can make life a little bit less stressful. Kind self-talk. The mind is in its own place and in itself can make a heaven of hell and hell of heaven. So we can all just take a time to think in our own lives. Have we got a good balance in our life? Can we improve or change our support networks? Are we working too hard? What could we change? What would we like to change? And what might be the first step towards that change? And about living in the present, making it now. So that's the end of our presentation. If anyone's got any questions, feel free, or we'll be outside for 10 minutes afterwards. Thank you.
Do we have time for questions?
People without CF as well. But from my sort of experiences, you come across a lot of adults with CF, between 20 and say up to 50, and just about 80% of them are the most positive, creative people that you can actually meet. And I think, in terms of coping, all the examples you gave up there are very valid, but I think CF people do make a difference because of what they've got. And I think generally speaking, there was no chart up there for that, and it's difficult probably to qualify it, but CF people generally, they get through to adulthood, there's better treatments, and they make their own life adjustments, and I think generally speaking, they're a very positive group of people.
Absolutely, and I think that was maybe we didn't really make it clear, but it was really interesting in terms of the research saying that people weren't realising those milestones that you might expect with the changes in your health. But maybe it is because you're pretty good at balancing things and you're doing a good enough job. But I guess the opportunity today was to kind of highlight some of the things where people might not be doing so well, and just an opportunity to kind of reflect where you're at and where to from here. And sometimes it is a pat on the back, actually I'm doing okay, but also it is a little bit about sometimes maybe thinking about the future and when things, and if they were to change, how you might manage that and look at some of those other things. But I think you absolutely agree with what you're saying. Yes?
I actually work with adults as well on this topic, and what I find is that the families that have continued to be involved with the person with CF, you know, that continual partnership, that transition is a lot easier, but we do have a group of patients that have difficulty coping with the what-ifs, you know, planning. And Sue mentioned have the debt, they've got relationships, and when I talk to them about their support networks or getting support networks around them, often their response is that they don't have anybody, and that's very, very difficult, or don't want to reach out. And so I find that there are patients that need a lot of help with that, you know, just sort of, well, you know, because there are people in their lives, but they assume that they won't be interested or wouldn't do or wouldn't know what to do. So there is the other spectrum of the very troubled people with CF about the what-ifs. They need to keep their job, they say to me. I've got no options. I've got a rented house and I've got a partner. Tell me what my options are. And sometimes that's all very difficult about where they could actually transition to during that stage of like pre-transplant. And so, so sometimes it can be that conversation can be very difficult.
On the subject of partners, my daughter's just starting in the second year of a relationship, and from this talk it's made me aware that I personally haven't looked at the partner to see how they're coping, and this talk has made me aware of that, because ultimately the partner is the number one support network for our CF people. So I know that there's a few partners in this room, and I'd be interested to know what the partners' experience has been as regarding the support they got when they first entered into the relationship, and what they would have liked to have received, or what good things have come out of it. So if there's anyone who wants to respond to that, I'd be really grateful.
Just before someone is brave enough to respond, I'd just like to comment about that in terms of I work in other areas as well as cystic fibrosis, and what I see is that there's a lot of tension on the person who's unwell, but actually it's the whole unit that's having to cope with it. And so sometimes it's equally important that if the person who's unwell is worrying about their partner or their parent, that's not going to help as well. So it's about looking at supports for everybody and recognising who maybe is in need. So I think it's fantastic that you've raised that, and it would be wonderful if someone was brave enough to talk about it from their experience. Yep. Is there any partners in the room? Yes.
No, I've got a daughter who's 29, and she's had 2 or 3 partners. She's even been married. But I find that in actual fact, she doesn't reach out for the help. She actually wants to just be normal. She wants to be too normal, and she doesn't actually want people to know. When she got married, there were people at the wedding that didn't even know she had CF, because she wants to keep that hidden. And I think that until we sort of make it more available, you know, and I rely now on the people at the clinic, and it's the field workers. They're the people that I rely on talking to her, because it's not the kind of thing that she actually wants to bring up with the physician. It's the other people, and I think we're getting better at that. I do know now that, because she goes to the Christchurch clinic, and they are talking to her more about that sort of thing. But it is a difficult thing, especially with girls. They just want to be a girl, and they don't actually want their partners to actually come along to clinic. But, you know, the one she's got at the moment, he wants to come, but she sort of, you know, she needs encouragement from the field workers to get her to bring him along, you know, and be normal. Yeah. It's so nice.
Don't really know what the answer is. The initial finding out and working out what it was all about was pretty rocky. But since then, the support of Graham's parents and learning off his mum, because she knew a lot about it, of course. And then, yeah, just support networks are huge the whole way. And the more you can be involved as a partner, the better. Conferences are huge, talking with other people. It's tricky that it's coming to a stage where we can't come. It's a biggie. Yeah. We've got children, so we're actually moving into the how to help our children cope now. So I got a lot from that. Probably going to bring our kids along to clinic and meet you guys and help with that. Graham's family has a history of anxiety and depression even away from CF, so we're seeing that in our daughter. Yeah, I have to stop there.
Those are, thank you very much. They're difficult conversations to have, those first conversations about talking about your health with someone else. And so obviously when you've got parents or other people who know you well, they're people who can help with those difficult moments. But it does affect everybody, and it's about looking at how to best get the support to work your way through it, because you can work your way through it. And as you've said, there's some really good examples of managing well, you know, living in spite of CF. You know, it doesn't have to be a big burden. It's about how you manage to work with it, draw on your resources.
And I'd just like to add to that having the opportunity just to have the space to bring up the conversation. Earlier, the mum was talking about her daughter not wanting to, excuse me, I don't know, the lady at the front didn't want her daughter to talk about her CF, but sometimes it's just creating that space of having a discussion around it, and there's sometimes no right or wrong, it's just having the space to, and even coming to conferences, having these discussions, it's just having that space to think about it.
I've also got a very independent 26-year-old daughter with CF who has... The problem is sometimes your goals are mixed. She's very keen on getting a master's degree in psychology, and it takes every minute of her day and night. And I'm trying to keep saying, oh, don't work so hard, you know, you don't try and get A's, and it's hard. But the other thing I want to say is, when you've been looking after a child for a long time, and then then you see them doing things that you know they're going to do because they want to be independent. I remember driving back from Wellington to Lower Hutt, and I was angrier than I've ever been in my life because of something she'd done, and I bawled my eyes out, but I just knew that I had to deal with it because I want a relationship with my daughter because she's so precious to me. So I have to, sometimes, yeah, she's going to do these things, and I just have to cope with that somehow.
Thank you. And sometimes it does seem harder because it feels like the risks are bigger when you see people pushing themselves in spite of. Yeah, so it's hard to watch sometimes, but that comes with being a parent, I think, too. Yeah. Okay, thank you.
That's pretty much all we've got time for today, but I would just like to thank you both so much. I think your quote up there, when shall we live if not now, is perfect. But I also think what it's done is, as Shelley said, is illuminate for us some stuff that we can use, tuck it away, future use. Some people will use it now, and just have it there in our consciousness to be able to help our adults with CF, our partners, our friends, the people that we care so much about, and thank you very much for that illumination. Thank you.